This is where the current challenge is. At present, 42 countries are rolling out safe and effective COVID-19 vaccines. 36 of these are high-income countries, and 6 are middle-income countries. So there is a clear problem that low and most middle-income countries are not receiving the vaccine yet. At the outset, rich countries have bought up the majority of the supply of multiple vaccines. Now, we're also seeing both high and middle-income countries that are part of COVAX making additional bilateral deals. This potentially bumps up the price for everyone and means high-risk people in the poorest and most marginalized countries don't get the vaccine. And some companies and countries have not submitted critical data, which we need to issue emergency use listings, which blocks the whole system of procurement and delivery. Vaccine nationalism hurts us all and is self-defeating. Going forward, I want to see manufacturers prioritize supply and roll out through COVAX. I urge countries that have contracted more vaccines than they will need and are controlling the global supply to also donate and release them to COVAX immediately, which is ready today to roll out them out quickly. And I urge countries and manufacturers to stop making bilateral deals at the expense of COVAX. No country is exceptional and should cut the queue and vaccinate all their population while some remain with no supply of the vaccine.
The people likely to die from this infection is not everybody in every country. It is very particular risk groups by age and by vulnerability who are likely to get very sick and likely to die. It is frontline health workers who are exposed to this virus every day. This is whom we need to protect first. It's not about the overall percentage of the population that's susceptible. It's not about the overall percentage of the population will ultimately be infected. It is, are we going to allow those people who are vulnerable and those people who are most at risk to get sick and die from this virus? That is what the DG has spoken to. The need for us now to take a step back and ensure that we distribute this vaccine to those who need it, to those who are most vulnerable and those who are going to benefit most.
This is a very dangerous time in the course of the pandemic, and I do not want to see people become complacent as vaccines are starting to roll out. Over the past few days, we have seen some of the highest numbers of deaths recorded at any point in the pandemic. This is happening because over previous weeks, there has been a lack of compliance with what health authorities are advising in several countries. The virus has taken advantage of this and is spreading at an alarming rate in some countries. You might think that it wouldn't happen to you, and that you don't need to comply with the measures. The problem is that before you know it, not complying a bit becomes a habit.